Hi, everyone. My name is Dr. Tony Janasia. I am an adult psychiatrist, and today I have the pleasure to be sitting here with Dr. Rusty Reeves. He is a professor of psychiatry at Rutgers University. He's also the director at the Rutgers Forensic Psychiatry Fellowship Program, as well as the director of psychiatry at Rutgers University Correctional Healthcare. Thank you so much for being here today, Dr. Reeves.
Thank you for having me.
So today, Dr. Reeves is going to be sharing with us updates on the duty to warn, as well as he's going to be reviewing the violence risk assessment with us. So Dr. Reeves, in terms of the updated duty to warn, how should we think about that?
Okay. Most psychiatrists are aware that New Jersey has had a duty to warn law, which is informally known as the Tarasoff law, since 1991. That's nothing new. And what's happened is in June of this year, 2018, Governor Murphy signed a bill that added a component to that duty to warn law that requires notification of police when there is a duty to warn.
Mm-hmm.
So it's added on a mandatory requirement to that duty to warn. I can explain that a little bit more if you wish.
Yes, please.
Okay, so the duty to warn law, just to review what it basically is there is a law that essentially, in a way, establishes, whether we want to or not, a standard of care that we have to consider violence, as well as suicide, but violence towards others, whether we like it or not. That's the duty to warn. The Tarasoff law was the landmark case that established this in California, and it's spread to many other states since then, including New Jersey.
Mm-hmm. Can you say just the basics of the Tarasoff law? So that was if a patient told us that they were going to harm somebody or harm themselves, that we had a duty to do something about that.
Roughly, yes, that's it. The words are important here, and that's what I'm going to go over.
Wonderful.
But yes, that's it in a nutshell. A duty to warn is incurred when your patient has communicated to you a threat of imminent, serious physical violence against a readily identifiable individual or against himself.
Okay.
And you believe that the person intended to carry out the threat. So there's a lot of words that are packed in there. I think intent is the important thing for the psychiatrist or other mental health clinician to understand. Mm-hmm. It has to be your belief that this person is serious about it. It's not just somebody in there complaining like, oh, I'm tired of my kid, sometimes I just want to kill him. Mm-hmm. We know that that person's not really serious. It's not really a credible threat. But when you believe that it's against a readily identifiable individual, serious violence, and the person intends to carry it out, you incur a duty to warn. Or more broadly, if a reasonable practitioner should believe that a person intends to carry out such an act, then you incur that duty to warn.
Mm-hmm. So if you really believe they're going to act on it.
Yes.
So if I have, for example, a patient comes to mind who is following his ex-girlfriend, tailgating her, so to speak, and he would follow her after work, but he didn't actually express he was going to harm her. In one of those kinds of scenarios where it's not so black and white, is it better essentially to take the higher road and make the call?
Well, I knew that you would give me that question, and that's the difficult question to answer. I would say technically, no. The person has not conveyed a threat. Mm-hmm. They have not said that they intended to do anything. Mm-hmm. The more broadly is, would a reasonable practitioner believe that the person intended to carry out imminent, serious physical violence? Mm-hmm. If you believe that that's the case, then you should follow through with the duty to warn. But I would say with nothing more, it's easy for me to say in this situation, I'm not facing it, but I would say no, that would not rise to a duty to warn. It's always helpful in these situations, and this is what I teach in my fellowship, mm-hmm. is that if you're about to make a responsible but somewhat risky decision, particularly to release somebody from an ER, release somebody from a hospital, or not put somebody in a higher level of care or call the police, you document your reasoning briefly. Mm-hmm. It shows thoughtfulness, it shows consideration. You could always be sued, but it's unlikely you'll be successfully sued.